Okay, it's fine, guys. Lady. Hello.
Même. Which one? Oh, it's separate student. Why you are trying to, yeah. And then this one we're giving, okay, yeah, little things that we can do to, right, put my WhatsApp, I'm opening the 12 files. Ah, it's okay. There's only 15%. Yeah, the other one was oh, she didn't no, yeah. It's my first one, but this is the previous one. And we can exit. We just want to test if colleagues are able to hear me. I think they're able to hear. Because we don't want it to be too loud. Yeah, test.
What the test?
We don't want it to be too loud, but we want it to just moderate. Is it fine? Yeah, it is fine. So we just leave it like this. Now tell me. In terms of, oh, this one's plugged as well. Oh, it's just. No, where is it connected now? I think this is fine. Yeah, we're ready to can. It's fine, this one.
Is it fine?
The only thing we can just pull this table to be backward a little bit.
That's one of the worst problems.
We don't want
You guys are fine and you are fine. I can say you are fine. We're going to present from the laptop.
yeah, you need from here. Okay. Go on. The order. Which one I'm starting with?
Yeah, it's off normal. We start with off and then
So we are covered here. We should give us the coffee first.
Yeah. But it's important that they control from here,
Yes, they can still control. They can control from there. Okay. Where's the separate one? Where's this one is the proper one? Where's the actual
the
meeting?
other one, we're gonna go out, and then it's here.
Okay, super.
Well, what are you seeing there? What are you seeing?
yeah.
Which one? The actual one.
Yeah, the actual one. Yeah.
So which one are we starting with?
We start with prof.
With prof.
We normally start with prof, yeah.
Oh, let me go to the Sego prof. Yeah, Emma, wait. Let me get these guys first to be already settled. When they sit, we start. I'll give you a signal. I think I'm just worried about the interference. Is it fine now? It's fine, eh? Colleagues from members of the media, if there's anyone who needs to bring their mic here, this is the best time. If you need to bring your mic here from the media, if you need to bring your mic, I saw colleagues as well from the SABC. I'm not sure if they want to bring their mic here. Otherwise, when we... Oh, is there? Okay, sure. I think the echo. Oh, okay. Are we able to reduce a little bit? I just want to avoid the echo. Just reduce a little bit. Reduce a little bit. You can still hear me, Musne? It's fine, eh? Yeah, it's perfect, yeah. It's fine. Are you able to hear me fine? From that side? Okay. No, then it means our sound is better. It's fine. Okay. Yeah, ma'am. The big one. Okay, sure. I must start. So I must do this too. I agree. You are not going to make it. This B, this two. 1, 2, equal P, and then we're going to do this. So I'm deleting this ones here. This one, I do like Procurado I write editing this square. A is about the game channel. Yeah.
Not.
Yeah, moving. Just come and tell me which one. Where was I going? I'm moving. No, no, let's yeah, let's show. I tell it was not doing this one. Yeah.
afternoon, ladies and gentlemen. We are going to speak to you today about our vaccination program. The Premier is here with the Mayor of Johannesburg, Councillor Mpomo Erani, and the MEC for Health, Dr. Mukheti. And we also have the MMC from the city of Johannesburg. And we have a member of the advisory committee, Professor Bruce Milado, who is going to start with a briefing to tell us about where the pandemic is. And then after Prof. Milado, we will have Ms. Mope, who will speak about our vaccination program. And then the Premier will conclude with the special call to the people of Gauteng to get vaccinated. So without any further waste of time, I would like to call Prof. Milado to come and speak to you. Prof.
Thanks for having me, Premier, DG, MEC, MMC, and HOD. I will briefly touch upon the situation of the pandemic in the province as we speak, on behalf of the Gauteng Premier COVID-19 Advisory Committee. So what you see here on the upper graph is the daily view, the number of new cases that we have currently compared to historical data. A very important figure of merit is that we seem to be stabilizing around 1,000 active cases per day at any given day, and this needs to be compared to what we had between the second and third waves, which was somewhere between 2,000 to 3,000. So we seem to have stabilized at a somewhat more significantly lower number. In terms of the weekly view, you see the plot on at the bottom of the slide, where you see that we are now, we've dropped by about 19% with respect to the previous week, down from 26. So it appears that many of our indexes seem to be stabilizing, and the drop seems to be slowing down. Currently, we seem to have about less than 1,000 cases, new cases per week. This is for the province as a whole. This slide here speaks to the rolling average per district, and also the incident per district, and we are happy to report that overall all districts are at low risk, and the numbers have stabilized in all districts and also sub-districts. In terms of officially recorded COVID-19 mortality, you see the daily view on the upper graph and the weekly view on the lower graph. You can see that the numbers are steadily dropping, and they are at a lower level also that can be compared to the beginning of the pandemic, somewhere before the first wave. And also the view in the insert of the excess mortality from the MRC also indicates that excess mortality has dropped significantly, where the official recorded numbers are compatible with them. In terms of admissions to hospitals, it's important to note that the admissions have dropped significantly, and they are significantly lower than during the period between the second and the third waves. We see that also with mortality and new cases, and that affects pretty much all segments of the demographics. Although one has to know that currently we still have 2,000 people in hospital. This is mostly driven by folks that have been hospitalized for a long time. But the new admissions have certainly dropped as well. In terms of mobility, mobility is extremely important because mobility drives community transmission. We see in the insert, especially the area that is enclosed by the ellipse, that mobility is actually at its highest point since the beginning of the pandemic, and it is actually quite close, slightly below, but quite close to what we had before the pandemic. So it's certainly good news that while mobility is high, community transmission remains low. This data is from Google, the corresponding data set from Facebook, where you can see the view in different districts, being those Sito Johannesburg, Tshwane, Kuroleni, Sedibeng, draws a very similar picture where mobility remains quite high. Now let me move on to the risk indexes. The overall situation in the province that we are is still in low risk. We are certainly, we have overcome the third wave. You can see the blue distribution, the blue graph, far below the medium and high risk. That's for the province as a whole. You can look at the situation in each of the districts. You can see there the situation in the province compared to those of the districts, especially in the graphs on the right-hand side. You basically see that we are basically past the wave in all districts, and we are still low risk. When you look at the situation overall in the province with the artificial intelligence powered index, you see that the red curve there is significantly lower than the orange threshold. That means we are still at low risk. Now, let me summarize to conclude, concluding with outlook and recommendations. While the situation in the Gauteng province remains stable and low risk, however, the risk of a fourth wave is very, very high. In fact, we predict that the fourth wave is very likely to be triggered sometime between November and January, as we expect quite a number of super spreader events to follow in a row. So that's something that we have to have in mind. So we should not be confused or misled by the fact that we are currently in a situation of low risk. That can change quite rapidly within weeks. As a result of that, the main message from the province remains the same, is that non-pharmaceutical interventions as per level 1 remain in force. It's now extremely important to increase the rate of vaccination and coverage in particular, and especially older age groups that are more vulnerable to contract severe disease. And we have to accelerate the rate of vaccination in view of the looming fourth wave, support vulnerable populations, and ensure that COVID-19 safe practices are adhered to during campaigning, registration, and voting in local elections. Thank you very much.
Thank you very much, Prof. Ms. Mupe.
Good afternoon, Premier and the MEC and MMCs and the Mayor, as well as the different media houses. I'm going to be presenting the state of the vaccination program in Gauteng. Just as a way of opening the presentation, I wish to say that the vaccination program in Gauteng has been running relatively well. We do acknowledge the fact that we have a long way to go, but we've been hard at work. We have not stopped. We've been continuously trying to increase our numbers, and we do see an improvement. But we need to do much more than what we're currently doing, because our numbers are huge when you compare Gauteng to other provinces. We have a very long way to go, but we will get there. We are positive of that. This first slide just shows you that in absolute numbers, if you look at the Gauteng and you compare it to other provinces, Gauteng is a province that has administered the most vaccines at 5.3 million. And when you compare it to other provinces, we're doing well at rate there, with the lowest province being the Northern Cape. However, you will see in the upcoming slides as I present, when I show you how we fare as Gauteng in terms of coverage, that is looking at immunization or vaccination per 100,000 population. This next slide just confirms what I've presented in the previous one, which shows all provinces on an upward trajectory, and also Gauteng in terms of percentages of individuals that are vaccinated as a percentage of the population in the Gauteng province. Gauteng is represented in red there. It is at 32.3%. You can see that the Eastern Cape, as well as the Free State, and Limpopo, as well as the Western Cape, are the highest. So when we look at as a percentage, as I said, we seem to be dropping because our numbers are bigger than other provinces. This slide here just shows you the vaccines that have been administered as at the 17th of October per district, and Johannesburg in red is leading all other districts. It is expected because Johannesburg is the district that has got the highest population when you compare it to the other provinces, and it is followed by Tshwane, and then Ekurhuleni, and then at the bottom we have Sidibeng district. So this slide just shows you how we fared in terms of the number of vaccines that were done, fully vaccines against the target population per district as well. You can see that the green part just shows you those that were population estimates, and then also the blue one just shows that the adults that are eligible for vaccination, and the orange one shows you individuals that have been vaccinated, and the red one just shows you how we fared in terms of those that are fully vaccinated. We have administered a lot of vaccines. The first dose, the person who's gotten either the J&J or the Pfizer vaccines, that would be a person that has ever received a vaccination. And when we are fully vaccinated, it means if you were using the Pfizer vaccine, you've gotten both the first and the second dose of the vaccine. So the graph just shows you how we fared as a province. This one shows the vaccinated status as at the 18th of February, and it shows exactly what I have said, that in terms of the total population for Gauteng, we are 15.6 million adults, and then the adult 15.8 people in Gauteng, and adults are 11.3 million. And in terms of the number of individuals that are vaccinated, we're sitting at 3.6 million, which translates to close to 33% of those vaccinated. And in terms of individuals, as a percentage, as I've said, we are at 23%. But when we look at ourselves as against how we fully vaccinated, we have 2.6 million people, and that translates to 23%. And those against the population, it is at 17%. This slide, and I think the follow one just shows you, it's a thermometer. Some people call it a barometer. It shows you how each district performs against the target that we've set, and against the province itself and other provinces. So as I said, this one will show you individuals that receive the first dose as a percentage of the adult population as at the 17th of October. I indicated that we are at 32%. And Johannesburg is at 36%, leading the pack, as I indicated, and it is followed by the West Rand, and also Tshwane, and then 27%, Ekurhuleni, and Sidibeng at 26%. The next one shows us how we fared in terms of vaccinating individuals fully. As a province, we are just at 23%, and again, we know that Johannesburg is the highest as 26%, followed by Tshwane at 25%, and West Rand at 24%, and Sidibeng at 18%. So this slide is just a repetition of what I said at the beginning in terms of the vaccines administered per 100,000 population as at the 17th of October. You can see that as Gauteng, in terms of vaccine as administered per 100,000 population, we are fifth from the bottom. And as we look at individuals that are vaccinated per 100,000, we are now at the third from the bottom. And then when we look at how we are faring against other provinces in terms of immunizing people fully, we are at the second from the bottom. I've explained how this has happened. And this slide just shows how our districts perform on a daily basis. We pit them against each other to see how each district is performing. And I know some people are going to come back and say, but we see a lot of dips in this graph that you're presenting. Yes, we do have dips, and these dips, we see them, particularly as the week draws to an end from Friday. and Saturday and Sunday, very few people rock up at the vaccination sites. Our vaccination sites remain open over the weekend. They are there, they are open, fully open. But it's a weekend and people want to do one or two things, they don't go to our vaccination sites. But we do have a serious campaign where we mobilize people over the weekends to come and vaccinate, because these dips are affecting how we are performing as a province. So this is individuals vaccinated per age group and gender as at the 17th of October. As you can see that we're doing relatively well for the 30 to the 39 as well as the 40 to the 49. Well, with the 50 and 59 we're not bad, but we're getting there. But if you look at it in terms of the gender, we're seeing that a lot of females are vaccinating more than the males. And I've said that, I think in my last briefing session, I did indicate that we really are appealing to everyone to mobilize our male partners to come to the vaccination sites. If you look at the numbers across all the indicators we're tracking for the vaccination program, females seems to be the ones that come forward for vaccination. And I thought it's normal practice. If you go to a clinic on any particular day, the people that you'll see at the clinic who are ill, it will always be females. And males are slow. They wait until things go wrong, then they come. So I can see the members of the media, the majority here I see are males. This is the message we're sending to you, to ask you to please pull in your male counterparts to help us with the vaccination program. So this slide just shows you how we perform. It's the same thing, but this it shows per age group. We still have to do a lot of work in the 39 to 49-year-olds. They came in and they were very enthusiastic at the beginning, but things have suddenly slowed down. But we are following them up and make sure that they get vaccinated. With the 50 and 59, we were struggling at the beginning, but we've since picked up the momentum because of all these mobilization campaigns that we are running across the province. I'm sure all of you might have seen our political leaders as well as officials and NGOs and everybody else that's involved in the vaccination program going about and ensuring that we mobilize people to come for the vaccination sites. So this will be the last slide from my side. This slide just shows you how each district has performed against the target that has been set for it in terms of the number of people that have received either the first dose and the second dose. So insofar as the target of 70% adults that we want to reach by December, I know this slide looks very busy, but to make it easier for people who are reading it, in summary, is that in the Johannesburg district, in sub-district E, seems to be performing better than the rest of the group. And we've got two sub-districts that are performing below 12%, they're at 11%. There's one in Tshwane and one in Ekurhuleni. So this is where we are focusing our efforts on to make sure that we bring them up to speed with the vaccination program. But we will get there, and they're working very hard. So as the last slide from me, I'm going to say that we are on course. We really are working very hard to improve our vaccination program, especially as it relates to us achieving the 70% by December. We're working very hard towards that. But we are appealing to everyone to assist us to get there, and also individuals to stop listening to all these conspiracies that are doing the rounds, that are creating hesitancy from the people that we serve. But my last parting short message to everyone else, and I've said it even in the last media briefing, is that even if you are vaccinated, you still have to wear a mask, you still have to do all the non-pharmaceutical interventions that we do, because as we go around, people claim that they have been vaccinated, so there is no need for them to start complying with the COVID-19 regulations. They're important, you still have to continue, because we know that if you're vaccinated, it will protect. If you contract COVID-19, you'll be protected from severe illness. So, ladies and gentlemen, I'd like to end my presentation here and say thank you very much for the opportunity. Thank you.
Okay, thank you, Ms. Mupe. Now the Premier will come and speak to you.
Good afternoon, ladies and gentlemen from the media and the people at home. Today we are doing this update right here in Soweto, in Dobsonville. We chose this area because Soweto is sub-district D. In the municipal sub-demarcations is called Region D. This is one of the lowest areas of vaccination. It has got the highest density in our province combined together. There are 1.1 million adults who are eligible for vaccination here in Soweto. And you will see from the report that has just been given now, if I can just go back to the slide that Ms. Mupe said is a busy slide. You will see in this slide. So Johannesburg D sub-district, that's 1 million adults, and it also indicates for us to reach the level that we are comfortable with, we need to at least vaccinate over 700,000 people here in Soweto. You'll see we have vaccinated with single doses just around 200,000 people. And the full vaccinations for this area is around 140,000, slightly under 140,000. That's 139,659. So single doses that have been administered here, it's just 20%, and full vaccinations in this area is 14%. So we are joined, the MEC and I are joined by the Mayor, Mayor Mpomwerani, and the MMC responsible for, amongst others, health, MMC Eunice Mpina. Johannesburg as a whole is doing much better than the other regions. We have the largest number of single doses, firstly just vaccines administered in Johannesburg. Out of the 5.3 million vaccines administered in Gauteng, Johannesburg has done the largest of them. Also, the number of single doses are the largest in Johannesburg. But the good story is that at least 1.1 million in Johannesburg are fully vaccinated. I want to come to my concerns, but to start by saying, Mayor, if you look, a full 1.1 million people in Johannesburg are fully vaccinated. Now, this is an equivalent, as you would know, of several provinces. Several provinces to do full vaccinations, even though their percentages are high, but you have said Johannesburg alone with full vaccination has done as well as several provinces. There's only 2 provinces that have vaccinated fully over that 1.1 million people. So, but if you check against the fact that the size of the population is huge, so we still have a long distance to cover. But I think just the idea that we have 1.1 million fully vaccinated people in Johannesburg is it's a very good indication of progress. But what is the picture? Our townships are lagging behind. So the substantial vaccinations are happening in areas, more suburban areas, and the townships are lagging behind. Those townships in the south is Orange Farm and Palestine. That's the lowest. We have the lowest vaccinations in the south of Johannesburg. That's where we have an 11% vaccination in terms of just single doses. 11%. The Alexandra is not doing badly. We are doing much better with the vaccinations in Alexandra. In the other areas, Deep Sloot, Cosmo City, we are also doing much better in those areas. The CBD, we aren't doing too well in the Johannesburg CBD, like we are, the same issue we are raising in Soweto. We aren't doing too well. Across the province, we aren't doing too well in Sidibeng. The Western vaccination program has come a very long way. We are doing very well in the West End with our vaccination program. So that's just about a bit about the numbers. Let's just repeat these numbers. 5.3 million vaccinations. Out of the 20 million vaccinations administered in the Republic, 5.3 million of them were administered in Gauteng. That's 26% of all vaccinations done across the country. 26% of them were done here. But if you come back to, with that 5.3 million, how many single doses? That's 3.6 million. Because we get a lot of double doses, and I think this is an important story. So the single dose J&J goes largely, and we understand that it goes largely to difficult terrains like rural provinces. So most of the double doses are the ones we use in Gauteng. We get a lot of people who ask for J&J. We do get some, but we understand why J&J must be prioritized to the difficult terrain of rural provinces. So that's why you would see that even though we have administered so many, 26% of the country's vaccines were administered here, but the actual coverage is lower because we need to get to full vaccinations, you need to do it twice. We have 4 million people who are registered on the EVDS system. In other words, people who have said, we want to vaccinate. We have 4 million of them. But we have a full 1 million people, and I said this last month. This number is not changing. We still have a full 1 million people who have only taken their first doses and have not come for their second doses. Of course, we are seeing that the second doses, people are turning up more on the second doses, but we still have people who have taken their first dose who are a little bit reluctant to go back to take, or they are taking longer to come back. They are taking longer. I want to say our vaccination sites are running very well. There shouldn't be people who are worried about queues. There shouldn't be people who are waiting for messages to say, come back. They should, once they know that their time for the second dose has come. So I am worried that we have a million people who have taken their first doses and are quite not as enthusiastic as they did with the first doses. And we want to appeal to those who have taken their first doses of Pfizer. We're appealing to them to turn up for their second doses. Just that 1 million will make a big difference for us. That is why, if you look at the single dose vaccinations, we are at 32%, but we are at 23% if you look at the full vaccinations. So 23% is not good enough for purposes of community or population immunity. That's not good enough. Yes, those who have taken their single doses, a single dose still protects you, but as we head to December, and as we want to appeal to those who have taken their single doses of Pfizer to come back for their second doses. So that's an extremely important message. So if you ask me, I am not happy with the overall number of people we have covered. Yes, we have administered more vaccines. We still have to contend with the fact that here in Gauteng, yes, we have to use more Pfizer than J&J. And that J&J has to go to the different provinces that are more difficult in terms of access to health services. So having shared with you that slide, I would like to just go back to the fact that the fourth wave is something that we're still worried about. We have seen in different parts of the world where the vaccinations have been happening very well, that when you have things like elections, when you have more opening up, the possibility for more infections happening is high. But if we have more vaccinations, that we wouldn't be as worried. With the rate of vaccinations we have so far, we are not at 50%. We are not even at 50% with regard to the single doses. As I said, here in Gauteng, we're at 32% single doses, both J&J and Pfizer single doses. We would be happier if we were at least at 60%. We would be happier. We still have a very long way to go. For people to be protected, we really have to reach many more people. Our teams are working flat out. So we've got the mobile and pop-up sites that are continuing to do work. And the big worry is that most of them are not as busy. And I want to even say that from the point of view of the election campaign, wherever we go, our message as the MECs, we want the mayors to do the same, and the mayors know where I am with them. The first thing we check everywhere we go is whether people are vaccinated or not. And we also check when we interact with people that they should be wearing their masks. It's extremely important. We can't afford during an election campaign to slow down on vaccination, because from the election campaign, election day is going to be the most intense, possibly the most intense with regard to how many people are going to be getting out. From the elections, we know that we go into the festive season, people are going to be traveling. I still want to appeal, we want to reach more people. There's really no difficulty anymore. We're making the vaccine available. We are reaching out as many people as we would like, but the people are not turning up. And our healthcare teams are continuing to do work. So we do want to make sure that people take vaccines. They are protected from the risk of severe disease and the risk of hospitalization, including the risk of death. We know that the scientists are saying even if you're vaccinated, you may still get the virus, but the chances of ending in hospital, very, very ill, or even passing on, the vaccines help all of us. The scientists are also saying that the vaccine also does have a positive impact on infectiousness, that it reduces the rate, the infectiousness, that even if you may get the virus, when you have taken the vaccine, when you are vaccinated, you are not as infectious in terms of the chances of infecting more people. So this is very, very, very important for us. We want to continue to call on people to vaccinate. I would also like to say that we are not retreating on our target for 70%, but the idea that we will reach 70% by mid-December, this is becoming a target that is elusive. At the rate we are doing now, we have just been looking, just in the last 2 weeks, the vaccination rate per day in Gauteng, on average during the week, we are just between 52 and 58%. I mean 58,000 between 52 and 58,000. We have fallen below the mid-60,000 daily vaccination rate. In September, we were doing extremely well. We were getting around 65,000, 70,000 daily vaccinations. We have fallen into the 50s now. That does worry us a great deal. So we can't be happy with that. We know that, again, I want to indicate that all people who are above the age of 18 have no reason at all. There have been many questions asked. If I take medication, can I go and vaccinate? We urge everybody who's worried to go to visit the clinic, go and see your doctor, go and see the nurses. They'll advise you. And across the board, it has been clear that there is the risk if you take medication, especially for chronic diseases, you can still vaccinate. The Minister of Health has announced that from Wednesday, the 20th of October, children between the ages of 12 and 17 will be eligible for vaccination. I do want to say to parents that we have a responsibility as parents to ensure that our children are safe. And if you want to ask from me, I think the issue on do children need permission or not, I think parents, we must take responsibility. Let's take responsibility as parents to make sure that our children vaccinate. Sometimes we make big issues out of nothing. I want to understand why parents shouldn't be involved in the vaccination of their children, like all other programs that our health department carries out. If parents are asking, but why should we not give permission? I would say that let's take our children to go and vaccinate. Let's not make it the government's responsibility. I should consent that my child should vaccinate and take steps to make sure that at least in the whole family now is vaccinated. It's a matter that as parents we should be looking forward to. So we go into a festive season because our children have been have over since the beginning of this cycle. Our children have also been getting COVID-19, and they go to school, they play different type of activities at school, so they will be safer. I am very relieved, I must say. I'm very relieved that the window is opening for the children between 12 and 17, but for single doses, and we will be guided by the Department of Health. But if you ask me, it's like that question about do you register first? If you ask me, the priority is to get the children vaccinated. And that should be the responsibility of the parents. The parents shouldn't sit at home and say, but the government says you don't need my permission. I think as parents, let's take our children to go and vaccinate. Let's not make it the government's duty. So that is my appeal, really. Like many other things, yeah, give consent by taking steps yourself. It shouldn't be an issue about whether you need a parent's consent or not to vaccinate. We are working out a program for all the schools in Gauteng. So the Department of Health and the Department of Education are developing a program. We are going to use our schools as the sites for vaccination of the children under the age of 17 in those schools. And we want the parents to consent. Basically, I'm sending the message to parents there. We are not vaccinating the children against your will. We really want you to be there to say that I want my child to be vaccinated. So we complete the full circle in the family, that all the adults are vaccinated and the children are vaccinated. We don't want to work against parents. We don't want to be fighting with parents. No, we don't want to be vaccinating children against parents' will. But parents, it is safer that now you will have a full family vaccinated. And I always talk about the Christmas lunch. you will have even the younger ones on the table at the Christmas lunch who have vaccinated. It's our responsibility to do so, and there's no need whether to have a fight about, no, should I give a permission or the government will do it. No, we want to work with parents. To deal with a pandemic, you need to mobilize people. People need to be convinced that it is the right thing to do. It is safe, and then it protects you as a family. That's the attitude of we in Gauteng. We don't want to do anything by force. We don't want to force people in the communities. We persuade them. We bring information to them and say, it is the right thing to do, that your child also is safer, because they are not invincible. They may be young, they may have stronger immune systems, but you also have children who already have comorbidities. So that's why I'm very happy that we will open on the 20th. We will open for children between 12 and 17. As a parent myself, I'm very, very happy. And I would like all parents to do the same, to say, I will make sure that my child is vaccinated. So let's do that. Let's take the steps, all of us, to beat this pandemic, because there are countries that are beating the pandemic. There are countries where the level of vaccination has reached a point where even if people are infected, it no longer impacts on the healthcare system. The countries like France, the evidence is coming from science. People are no longer dying at the rate they were. So it changes from being a pandemic that poses a great risk to a manageable, a really, really manageable disease. That's what we would like. We can only do so with vaccination. But we also want to encourage this vaccination because we want to restore some degree of normality. We saw an exemplary thing about opening a little bit with sport, with the game of Bafana Bafana. Yeah, I know that we start with a smaller number of 2,000, but I know that there are many fans who are saying they are looking forward to a little bit more people participating in sport activities, including as fans who participate in our programs. So emphasize vaccination is free. Nobody is required to pay for vaccination, and we have sites that are available. We work very well with the private sector in Gauteng. Our numbers have been able to stay at least above 50,000 because of the work done on various private sites as well as on public sites. I want to appeal to the political parties. The political parties have a responsibility to adhere to COVID regulations. And that is why I say, even as we gather, let's make sure the first thing we check, we send a message to the supporters. Each party should be sending a message to its supporters that they should vaccinate, they should wear their masks, they should continue to adhere to these measures. And we must continue to carry this message. As I said earlier on, we can't afford to slow down during elections. It is something we really, really cannot afford. We are moving ahead at great speed. Between now and mid-December, to be comfortable, we should vaccinate another 4.4 million people, to be comfortable. And I'm saying to be comfortable because already we are lagging behind. And I think I can't say that we are doing well. As long as we have that number of people that are not yet vaccinated, this 4.4 million people could be a problem if we get to the fourth wave much, much quicker than we. The 4.4 million people could end up in our hospitals, overwhelming our healthcare system, and some of them could really, really succumb to COVID. So we need to find these 4.4 million people. Our community health care workers, MEC, must find the 4.4 million people. We can't force them, we know, but we must convince them. We must persuade them. Our healthcare teams must be able to find the 4.4 million people. Mayor, the Johannesburg team has done well, as I said, to have a full, out of 2.6 million full vaccinations in Gauteng, 1 million is from Johannesburg, is doing extremely well. But Johannesburg is a big place. So we still have to do more. And I would like, even in the midst of an election campaign, I would like to see our mayors in Gauteng, our MECs and MMCs going around to communities on the vaccination message. So we can't park vaccination. We can't park getting to the message to our people that COVID-19 still constitutes the greatest threat to everything we are trying to do, rebuilding the economy, to livelihoods, to lives. At the rate we have been able to vaccinate, we still face a huge threat ahead of us. So our message is simple. We are also engaging different sectors of the economy. And let me tell you which sector of the economy is really lagging behind. The retail sector. People in retail complain to us that they don't get time to be able to go and vaccinate. Other sectors are doing extremely well. Finance, doing extremely well. The level of vaccinations in the finance sector has been extremely well. Some of the industrial sectors are also doing much, much better. Mining is doing very, very well. Especially in the West End, we have worked very closely with the mining houses. The vaccination in mining is proceeding extremely well. The liquor industry has just joined us now. And one of the important things is that they are also saying that they would like to vaccinate in those establishments, in the shebins, including in the shebins, in the townships, those outlets, in the entertainment areas. So we welcome that type of partnership. The insurance companies have also been doing well, leading by example in our province. We have done very good work. We continue to do that with the automotive industry in our province. And then the tourism and hospitality is an area that we will also say, I don't want to vaccinate. But most of them say to us, we are working odd hours, and then after that we live in different places where during the weekend we're not able to access. So we're going to go to them, directly to them. Retail is going to be between now and December. We're going to be targeting the retail establishment, and then we do schools for the children under the age of 17, between 12 and 17. So our message is the same. Vaccination is continuing. It must continue. The election campaign can't interrupt vaccination. And the campaigns themselves must adhere to the regulations. And that is the special plea that we are making to all the political parties. And we would like political parties in their messaging to continue to say to people wherever they go, people must vaccinate. So thank you very much. We will have to do much, much more. If we could do better if there was more J&J. I certainly know. We go to communities, people say, no, if you don't have J&J, sorry. We could do better with more J&J. I mean, the single dose vaccine. We could do much, much better. But we also understand that we have a more privileged healthcare system from access point of view. It's the rural areas. Yeah, we do need more J&J. Thank you very much.
The
The mayor is so used to clapping hands in the council, so even at the press conference he claps hands.
Thank you very much, Premier. We will now take questions. Yeah, can I see an indication who wants to ask a question? I don't see any hands here. Oh, okay, yeah, there. You don't have a mic, you can just speak.
Okay. My name is Asanda from the Citizen newspaper. I heard the Premier saying the townships in Soweto are lagging behind. What is being done to help the people understand that vaccinating is important?
Okay.
It's Ndayezo from Power FM. I just need clarity. So you are now saying that your realistic target is to have at least 10 million people vaccinated by the 15th of December. Just for clarity's sake, is that the realistic target now?
Right. Those are the questions. Oh, sorry. Yeah, please go ahead. Okay, thank you. I don't miss any other hand. Alright. Let me check if we did receive any by WhatsApp. I think there was one from Nigeria, so yes, already asked here. Okay, Premier, you did indicate that if the mayor wants to say something,
And the MMC, just on Johannesburg.
Okay.
I'm not sure if you can see me. Thank you very much, Premier. I think I'll attempt to answer the question asked by Asand, I think, as well as yourself over there, in terms of what is it that we do to make sure that people come out in numbers. We have our foot soldiers who are always on the ground, making sure that they give education to our people in as far as vaccination is concerned. So the challenge is that our people are not responding. It's possible that they're not responding because of the myth that is out there, which we try by all means, Premier, to try and explain to our residents the importance of them getting this vaccine. We try by all means. Our educators who are going all out, they do explain to our residents, but still the turnout is quite bad. But we are saying we will not tire, we'll continue to talk to our residents, engage with them, make them understand the importance of getting the vaccines. And of course, the 70% target that Premier spoke about earlier on, I'm not sure of the 10 million number, but I think the 70% is what we've been working on. And by the look of things, Premier, I see that we might not reach that target. But that does not mean that we'll stop engaging with our communities. The only hope that we have now is that of engaging with our communities and getting them out of their houses to come and get their vaccines. We'll be starting with the schools as well, engaging the retailers as well in our region, in our sub-regions as well. So it's what we'll be continuing to do until we get this thing correct. Residents of our city, it's very important to get the vaccine. It's very important for us to go back to normal. Things are not normal. Restrictions are eased now, yes, we agree. But COVID-19 is still with us. So we're not yet off the hook or out of the hoods. So it's important for us to continue engaging with our communities, and we'll do that, Premier, with, of course, the help of the province as well. as you always give us support, as well as the executive mayor. And I think I'll end the Premier. If there's something that the mayor wants to say, I think he can do that. Thank you. Oh, okay. No, the mayor is just reminding me that even tomorrow we are rolling out a mass mobilization plan as the city of Joburg, wherein we are encouraging all our employees of the city to get their vaccines. Of course, not alone that, we'll be ferrying residents who will be coming from different regions in Johannesburg, I mean sub-regions in Johannesburg, who will be coming to get their vaccines even tomorrow. The mayor on Friday, he'll be taking the family, his family, to get the vaccine as well, the younger ones who are actually 12 and 17. So it's something that we would not tire to do, Premier, as you are saying. The focus now is elections, but we will continue with the plan of the vaccination. So it's in our plan. Of course, we'll be going out in numbers with our different partners that we have in the city to get our people vaccinated. We have now extended the services of vaccinations in other clinics. There were clinics in the city that were not vaccinating. So we have now started today, in fact, Premier, we have clinics that are now opened to do the vaccinations as well. Thank you.
By sheer size of Johannesburg, we are convinced that if the city pushes a great deal in Soweto, in the south, that's where the big populations are, in the south, in Soweto. In the south, we will see a big difference. We had similar campaigns in Sidibeng and in the West End. We use data, we use science. So when we look at the numbers, I said to you, we have only done 200,000 single doses here in Soweto out of 700,000 people we should be vaccinating. So there's still 500,000 people that we really have to reach, even with a single dose. Right here in Soweto. That's why we need a very active program from our city. We're doing the same everywhere. So ask a question. So what else may be accounting for the townships to lag behind? I think it is a number of issues. One, it has to do with the ongoing issues around stories that are moving around. You know, somebody who is vaccinated and who passes on, and the story becomes that they passed on because of vaccination. Fortunately, in South Africa, all the deaths that have happened after vaccination, those deaths are that SAPRA does, at least when they are reported. There may be areas where there's no report. When they are reported, SAPRA does examinations and investigation into those, and we have been reassured. We have been reassured by the relevant authority that where someone has passed on after vaccination, it has nothing to do with the vaccination. So this message, we are taking it everywhere we go. We want to repeat the message that someone may pass on as a result of other causes. And that's why in many instances we are able to say that report if someone has passed on, so that there's an investigation and then it's a full report that gets done. But the incidences are very, very few relative to how many people we have vaccinated with at least one dose in Gauteng. The incidences have been few. There was a period where male hesitancy was a big problem. I think we are cracking that. I find that we find a lot more men on the ground when we do the vaccination program. We find a lot more men turning up because we go and visit many places. And usually the key issue has just been that we don't find too many explanations about why men have been hesitant, except that they have no good, women have no good relationship with the needle. We just need to encourage people to do that, to be able to do more. So the stories we have heard before that would push people back. A lot of people get convinced when they are reached by the campaign workers, our community healthcare workers, our community development workers, which is why the only way to really get people to come in large numbers is to go to them and reach them. There are a few places I've been to. For example, I was at a place where they told me the clinic is very far or the vaccination site is very far. I was in Sebokeng earlier in the week on Wednesday. They told me the clinic is too far. We have to take a taxi to get there. So we immediately organized a mobile unit. I was in a meeting where I asked how many people are vaccinated and found that less than half were vaccinated. I asked them why. Then they told me the problem is that the vaccination site is far. So in those instances, we bring in these mobile vaccination teams. We visited large sections of Soweto during the pension payout for the elderly and spoke to a lot of the elderly people, and we found that most of the elderly people are very receptive to the vaccine. We didn't find lots of stories about why they don't vaccinate, but in Gauteng province we have, with regard to the 60-year-olds, we're just about 50%, 52% of those at the age of 60 and above. Is it good enough? I still think we would be happier if we had 70% there. We just at 52%. We are at 48% with regard to those between the age of 49 and 59. We are 58%. Is it good enough? I would be happier if we were at least 60%. We are much lower with regard to those between the age of 35 and 49. I think we are 24% or so. We are much lower. They are a big number on their own. We still have less of them who have vaccinated there. So we are using all combination of campaign messages and strategies, but I want to say that we will do everything. And I think the message on the vaccine must shift to the election campaign. Every election campaign platform, that's the message I really would like to appeal to political parties. As you do your door-to-door work and as you do your campaign activities, please get this message on vaccination out there. So that's really what we would like to do. We are not changing the target, and we are not changing the target because 70% is still from population immunity point of view, reaching 70% is still the ideal thing to do. And I wouldn't want to change the target, but I can see the rate at which we are vaccinating, we are not going to reach that 70% by mid-December. And that's part of this message we are getting out there. And the only reason we are not doing that is because people are not coming back for their second doses, and people are not coming out even for their first doses. That is a matter of great concern to me. We went through a terrible third wave. The third wave was ravaging. It was, we still have 2,000 people in hospitals in Gauteng. 500 of them are in public hospital, and 1,500 are in private hospitals. They have stayed longer. So there are not many hospital admissions. That much we can feel, the system can feel. And the difference that vaccination program is making. So there are not many new hospital admissions, but we have people who have stayed longer in our hospitals, and they are staying longer in our hospitals. As a result of the third wave infections, people are still, as I say, I think these are the police doing their work. They think that maybe we are breaking the law here. No, we are not more than the number required. So I want to emphasize that we can't change the target, because that target is the right thing to do. As the MMC was saying, all we are saying is we can see we are not going to reach the target. And that's why we are getting the message out there. People are going to be traveling to different provinces. It is very dangerous not to have taken your vaccine. You are going to be in public transport. You are going to be going to Limpopo, to the Eastern Cape, to KwaZulu-Natal for the festive season. It is better that you travel when you have taken your vaccine. It is better for you. It is better for those you are going to be traveling with. And it is better for the people at home in the rural areas, that you are not bringing coronavirus from the city to the rural areas. So we really, really want to appeal that it is better for all of us to take the vaccine before the festive season. Thank you very much. I think we are done. Did I leave any question? No, you are covered. Thank you very much.
All right, thank you very much. We have come to the end of the briefing. Thank you. Okay, all right, yes,